If you are in midlife and a woman and your skin is freaking out and it's making you freak out, this episode is for you. Whether you're on hormone replacement therapy or not, our skin will still go through changes during menopause, and fluctuations in our hormones, either from too much or too little, can definitely impact our skin and hair. If you are menopausal or perimenopausal, and just not sure what is going on with your skin, you're definitely going to want to stick around for this episode. I'm joined by board certified dermatologist, Dr. Brenda Dinneman. She joined me a couple weeks ago, and we had a great discussion all about changes that happen in our skin during menopause. And it was so popular, we're bringing it back for part two, where we're really going to take a deep dive into the changes, some other changes that happen in our skin, from sweating with hot flashes to large cystic acne to what happens when you take testosterone or too much testosterone. And we're going to be taking a deep dive into how these hormones are affecting our skin in midlife. Dr. Denneman practices in Vienna, Virginia. She has over 30 years of experience as a dermatologist, and I'm so thrilled she came back. Definitely stick around for this episode. Dr. Denneman, I am so glad you are back for part two, because part one was phenomenal and amazing, but we just barely skimmed the surface on menopause and skin health. So thank you for coming back.
Yeah, I'm so excited to be here. And like I said last time, I've been still binge watching. It feels like every time we turn around, there's such a great new podcast out there that we can learn from. So we're excited to add to it.
Oh, yeah. And I find not a day goes by that I'm not asked. And this is outside of the clinic, right? Where someone finds out I'm a dermatologist and they're perimenopausal or menopausal, and they're like, what do I do? What's going on? Help me. Do you get that?
Absolutely. And I think now that more and more people are on the hormone replacement, we're starting to see some effects in the derm clinic. We're starting to see some people getting acne, some people getting problems from different dosings that they're being put on. So I think we should talk about that. It's kind of interesting. I think we're going to gather some data over the next years for sure.
Yeah, well, let's jump into that, because I feel like for so long, hormone replacement therapy was like, oh my gosh, horrible, don't do it. You'll get cancer. And now there's this pendulum swinging saying, wait a minute, we actually have data to show that it is safe. And so I do see that more women are seeking it out and talking to the doctors about it. But what are some of the skin changes you're seeing for people either on hormone we'll start with that, right? Like, on hormone replacement therapy, what are some of those changes?
Well, I think pretty quickly after taking one of the classes and learning and kind of questioning when I was in the class, has anybody seen problems being on progesterone? Has anybody seen any acne? I had 3 back-to-back patients come in, all about 50 to 55, who were getting phenomenal improvement in their hot flashes, feeling better, some having joint pain improvement, various things, but all 3 had a flare of their acne. So I thought it was fascinating. One had pretty large cysts that had developed, and the others, one was a known acne patient, and she started to have a flare and hadn't had a flare in years, and the same with the third one. So I think it made me very curious, like, what's going on and what's triggering it? So for me, of course, you're gonna think it's testosterone. They weren't on testosterone. We definitely know that progesterone, like the implantable progesterone, the injections can trigger acne in young people. So progesterone does seem to trigger the sebum, and estrogen actually can control or decrease it. So, anecdotally, one patient came back, the acne was all better and more control. We gave her some support topically, but her patch had gone up in strength. So I have a feeling that we're going to start seeing that maybe patients that are started on the 0.375 and the 100 of the micronized progesterone, they get some improvement in symptoms, or maybe they don't. But then when their patch went up to 0.5, but when their acne was not flaring. So I think it's going to end up being a balance, and it's going to be really fun to maneuver this as it happens.
Yeah, very interesting, right? Hormones are so powerful, and I know there are people who go on birth control and it can make their acne flare depending on what they're on. But yet there's some forms of birth control, especially the ones with drospirenone, right, that we use to help treat acne. So it's complicated. It's not black and white, but that's really interesting. And it's important that women who are menopausal are on progesterone if they're on estrogen, right, to help prevent other cancers. So you kind of need to be on it if you're going to be on hormone replacement therapy, right?
Exactly. And I think the other fun thing that happened is 3 new patients came in, all about 72 to 74. And without looking at their age, I looked at them, I'm like, wow, they really look great. They look young. And I looked at their age and there seemed to be a disconnect. And all 3 had stayed on hormones throughout all this time. They ignored the studies and they were someone who had been on hormone replacement for now 20 years. I know it's not a real study, but it showed. And they felt good. Their skin looked had more lubrication. The barrier was better. They definitely had, less evidence of excess hair on their face. They had lost their hair because we know that as you go through menopause, you can not only grow thickened hair and some vellus, soft hair, but you can lose your hair. So it's another important reason to go on hormone replacement from a dermatologic perspective.
Yeah. No, I definitely see those issues too. The thinning of hair, where even people who had thick hair, they notice more of their scalp showing. And then they'll say, "Oh, I'm getting a mustache," or I'm getting dark hairs, I'm having to pluck. And then also that peach fuzz. So what's going on there?
Well, I think it's interesting. I did some research and the definitely we see more peach fuzz, that little vellus hair when you are getting perimenopausal. The estrogen's going down, the androgens are a little bit more in control there. But you also can see it again when you get on hormone replacement, it's not the right balance. Had another patient came in that literally had an inch long vellus hair on the face. I'm super curious. I want to see her levels. I'm not sure what it really means. There may be something going on with the adrenal gland too. But I think we can help it by balancing the estrogen and making sure that, you're not giving too much like testosterone topically, or also do you have to support by doing something like spironolactone?
Yeah, I was gonna say, how do you treat it if you are struggling with these issues? Like,
Well, you can go back to using a fluorinathene, which used to be Vanica. I don't know if you remember that.
yes, I prescribed it.
Yes. Well, we used to prescribe it and then it got taken off the market. Not there was anything wrong with it. I think it wasn't profitable. And now we can get it through a compounded pharmacy like Skin.
I am so excited when I saw that it had come back because I had patients asking for it and they couldn't get it for a few years.
Yes, exactly. So, and the other very interesting case I had was a patient. It was a little bit of a sad story. She went to someone for hormone replacement. She had been on oral estrogen, sort of the traditional treatment for many years. And then during COVID, I think someone took her off of it and then decided to put her on the patch and progesterone and also testosterone. Well, apparently she was put on almost like 6 times the amount of testosterone that most people are using, dramatically had thinning of the hair, had some excess hair, was distraught as can be. And it's been months and months of trying to support her, not only with an endocrinologist, but also kind of digging in deep. So I think it speaks to making sure you know who you're going to and who's comfortable with really doing this, because we always want to do no harm. And that's the most important thing.
Right. Well, and I think testosterone is tricky from what when I had Dr. Kelly Casperson on, that there really isn't a dosage for women. It's just for men. And we're left to try to tweak it or give a small amount to help women, but that we don't have anything just for women. So I find that this happens more frequently than it should, is that women, and I see it in patients too. I'll see signs like they've got a lot of chin hair and again, thinning hair or maybe acne. And then I look at their medications and sure enough, they're on testosterone. So, all these things have benefits, right, that can help, but then there also are trade offs, right? There's side effects, there are things that can happen. So you have to weigh if it's worth it and if, the benefits are worth maybe a few extra hairs or some acne.
Yeah, and I was actually happy to research and realize she was on a very large dose. I don't gonna see it as much with what we're supposed to be prescribing, the compounded ones, so that I don't want people to be afraid. I think it's more that someone didn't give them the right dose, and so we have to do our due diligence and make sure we're doing what's right for the patient. But those are super interesting. Just I think we're gonna see more things like that, but I was so curious with the patients who had stayed on hormones all this time. And I think it loops back to, can you go back on them if you're 60, 65? We know you can do vaginal estrogen, but can you go on a low dose patch and progesterone even though you're not treating hot flashes anymore? Some people still have them, but are we gonna get benefits? And I think that's where the great research is gonna come in the next 5 years, hopefully.
Yeah, and I think the Gen Xers and millennials who are approaching perimenopause and menopause, it'll be interesting to see what sort of the narrative is. I find that the people I'm around are very much for the benefits of estrogen, but then that's just probably because my group, that's what I'm interested in, but I still think for a lot of lay people out there, they're still scared of it. A lot of doctors won't prescribe it even when they ask for it. So I think we still have a lot of educating to do about it.
Yes, and it's hard because people still say to you, "I think I'll just tough it out," or "I'm fine, I don't need it." And I said, we're really changing the narrative. It was not about toughing it out. That's the way I was put through menopause. "Hey, do you really need it, or are you okay?" And you'd say, "Oh, yeah, I'm okay. I don't need it." Yeah, sure, I have some palpitations. Sure, I can't sleep at night, but you blame it on teenagers or you blame it on your lifestyle. And, it'd be fascinating if you could go back in time and see what it really felt like. I think the other curious thing, and I've heard it in some of the podcasts, and I agree, is we have to watch how do people really feel on progesterone because there is a population of people that feel a little bit down and depressed. They can feel calmer sleeping, but I know that I remember feeling that, and I remember having patients say, "I don't feel good." But it was a different form that was being used at that time. It's not micronized progesterone, it was so I think that could be a part of it too, and it had more of a effect on creating acne and other side effects, so
Yeah. Well, and now there's the IUD, right? So people may just, if it's the one with progesterone, like Mirena, they may just keep that in and then they don't have to take oral progesterone. So, yeah, I feel like there are different ways to go about it. But that's interesting that you notice that it was the progesterone that seems to be causing these issues with the skin and acne.
yes, and I think also that you forget when you start maybe you're gonna see this more in your peers when they get started on hormones, they may get a burst of acne, but no different than we see during the cycle of their normal life when they were ovulating or having their periods, because people are still gonna be having bursts of estrogen, bursts of hormones. My impression, my understanding is not gonna go doesn't go to 0. So we could still see that, and then people all get frustrated and think it's the HRT, but maybe we're just still maneuvering what the right dose is and what they're gonna need for their special situation.
Very interesting. What are some other changes that people going through menopause struggle with, like skin wise?
I think definitely dryness, the loss of the barrier function. You notice your skin is more dry, your hair is more dry. If you color your hair, you notice it's still stripped. I used to have the straightest, most shiny hair, and it changes. And it's one of the, I think your skin gets drier also. And then the crepiness of the skin. You look down one day and you're like, oh God, those are my mother's hands.
I looked at my elbows working out today and I was like, oh, my elbows don't look like all the 20-year-olds in here.
Wow. I think that's something to take into consideration and why we're so motivated. Again, we only had moisturizers that felt like and facelift for a longest and now we've evolved into this whole regimen of possibilities. We're always talking about tretinoin and retin-A that's never gone away as being a helpful if you can tolerate it. And you have to hang in there with it. So
Yeah, that and sunscreen, right, takes you really, really far. nowadays, right, we have neurotoxins, we've got fillers, biostimulants, energy based devices, lasers, of so many things. It's kind of overwhelming. Like, what are some of your favorite treatments for crepiness, right? If someone's like, oh, my skin's crepey, they're on tretinoin, they're wearing sunscreen. What are some like in office things that could be helpful? Or I guess at home too.
Yeah, I mean, I like, Dermend, which is over the counter, actually does help the crepiness of the skin. You just have to use it every day. It's very cost effective.
Is it a retinol?
No, it's, to be honest, I don't really know what the active ingredient is.
Tell me what is it called?
It's called Dermend. I think I even have it in my drawer here, but, and it's interesting, it was only about $10. It does have a little retinol, glycolic niacinamide, and, some of the dermatologists did some investigation on it. It was only about $10 on Amazon about 4 years ago. Now it's probably about 30 because it's the secret's out.
About Dermend. Yeah, I didn't know about this.
Yeah, and I think we learned that at our skin sanity meeting. This is just a really creative meeting that always has great tips. And then I love microneedling. I was such a skeptic of it when it first came out, like in 2012. I thought this is ridiculous, but it actually is super brightening and refreshing for people's skin with super low downtime. And then we are going back to doing a lot of peels. We used to do so many peels. Again, we would probably have, 500 patients getting peels, and then lasers came in and it sort of knocked out things that worked. Again, thankful to a lot of our colleagues, they're teaching us the importance of using everything from mandelic to glycolic to salicylic, whether you have acne, whether you have pigmentation, and trying to do things that are low downtime. And I would say my newest favorite is the Lazen D Ultra, the 1927 thulium, which, if you remember, Fraxel had a thulium component to it. Clear and Brilliant is like a weaker version of it. Moxie is a weaker version of it. And Lazen D is better for pigmentation, freshening, brightening, and also helping a little bit with scarring and the texture of the skin without having downtime. Because we know there's lasers if you really want to go for it.
Yeah, there's a whole gamut, right? And I love a good chemical peel. I do find in this age group, we're seeing signs of sun damage and a lot of times even skin cancer. So sometimes just doing a strong chemical peel if needed, or a fractionated laser, right? There have been studies showing that that can decrease precancers. So it's not just making the skin look better, right? It's actually making it healthier, preventing these precancers from coming up, and hopefully preventing skin cancers down the road. So those are all great options. And you don't always have to have major downtime, although you can get some really phenomenal results if you do have a week of downtime for a strong laser or a strong chemical peel.
And as we know, just being holistic, like eating more plant-based, trying to avoid dairy and inflammatory triggers because that's going to contribute to your acne, but it's also going to contribute to, I think, your skin looking ruddy and flushed, and that, we have to address that. We can't ignore it. It's definitely eating high glycemic foods. We see that a problem. I notice people that give up alcohol or drink less alcohol, their skin looks fresher. There's a lot to work on, but at least the things we can control, we can try to make a difference. Yeah.
I remember learning about AGEs, advanced glycation end products, which basically happen when you eat food that's really charred or sugary processed foods. And basically, it makes your collagen more brittle and more prone to breakage. It's not supple and strong like it was. So, to me, I do have a sweet tooth, and I was like, oh, shoot, I need to maybe pay attention to this a little bit more. So I do find, yeah, and all of that's great for your health in general, right? If getting nicer skin is what gets you to do that, great. But it's really your whole body is going to benefit from making those changes. What are your thoughts on alcohol?
Well, I think that less is better. It's hard to. We have a very alcohol-based culture everywhere you go. One thing I learned from having a family member that had some medications they couldn't drink anymore was that we're finally getting some substitutes like athletic beer that, and I know, like I read an interesting study where there was so much peer pressure in the UK to go out during the work week and to have a beer. And a lot of people wanted to go work out. And they're like, if I have a beer, I can't go to the gym. So by drinking the non-alcoholic beer, they sort of felt like they were socially fitting in, not sticking out, that they weren't doing that, but they were able to live their life and not consume as much alcohol. Now, I don't think there's a non-alcoholic wine that I'm crazy about.
The thing with some of these non-alcoholic drinks is a lot of times they're just chocked full of sugar, and I just don't want that either. So it can be tricky. And yeah, I'm with you on the whole. There's such a social component when you're out with friends and celebratory and things like that. It can be tricky, but certainly thinking about or trying to limit your alcohol. I mean, I can't believe I've had patients and friends and family members who have cut down significantly in their drinking, and just this puffiness, the inflammation in their face goes down, and it's like a different person. It really is astounding. And that's the only thing they change, is they just either stop drinking or significantly cut back. And just that puffiness, that swollen look goes down, and they just look so much younger and healthier. It's really amazing.
Yeah, I literally had a guy come in that I was just gonna do a skin exam, and I just said, "Something looks different about you. I don't know what it is." And he said, "Well, you know what? I stopped drinking alcohol 3, 4 months ago. The skin looked fresher. He didn't look as red." We know it creates redness and flushing and rosacea triggers, but this was different. And it was probably the first time I'd really ever noticed in a patient that I noticed first, and then they brought up the reason.
Yeah, I think, again, I still enjoy some wine, but I do think about, how many times a week am I doing that and cutting down. I feel like during COVID it was like, nightly. So just trying to be more cognizant with that.
Exactly. So there's a lot to keep up with when you're trying to take care of yourself, as we know.
Yeah. Oh gosh. What about collagen supplements? Do you find this helpful? Because I feel like the message, especially for middle-aged women and menopausal women, is we lose collagen. We know there's a big drop with menopause, and we know we're losing protein and we're losing muscle mass, right? And there's this big like push to eat more protein. Do you find collagen? Is that something you recommend to your patients?
I used to say no, that it didn't work. I used to say, I think it's a waste of your time, waste of your money. But I think, again, recently, always learning something new, there's some studies showing there is some increase in your collagen and your elastin in your skin. So I think you have to supplement it with other things that you're doing. You got to do the retinol, you got to do sunscreen, you have to pay attention to your diet. It's not going to be a one step improvement, but actually, there is some data showing it's helpful.
Right. And a lot of times people will just put it in their coffee or in a smoothie, and you don't taste it, and maybe it does help. I remember also being like you, where thinking there's no way you swallow this and it's going to know to stimulate collagen in your cheeks. There's no way, but actually they found that it's not that what you're actually ingesting goes to your face, but what it does is it signals the fibroblasts that make collagen, it activates them. So, yeah, I mean, I think that it's certainly worth a try if you wanted to do something at home.
Yes, that's great. And I think that it's just a combination of things. That's the real thing, and I think that's what can make people so confused. There are too many choices. So you and I always go back to start somewhere, start with the sunscreen, start with some maybe one procedure, whether it's a peel or you wanna go ahead and start with the toxins to soften, your lines. All those things that, we know that using toxins can also help somewhat with migraines. They can help with sweating if you tend to be a person that sweats a lot when you work out and then break out. So you have to start somewhere and do baby steps and then hope that people will give you honest advice about what's best for you.
That's a good point. Like we're talking about all these different things. It doesn't mean you have to do every single one of them, right? Like there you absolutely don't. So I love your idea. Start with a few things, start with like the key things, and then add on if you want or you don't want. That's totally up to you. But at a minimum, sunscreen, right? And try to eat well and exercise and sleep and maybe think about alcohol intake. But you don't have to jump to doing all these lasers and peels and aesthetic stuff if you don't want to, but they're out there, they're options, and there's some good options. So I think, yeah, finding someone you trust and having that relationship with them where you can come up with a plan of things you'd like to accomplish with your skin for the first 6 months or year or 5 years, things like that, I think can be helpful. Because yeah, no one can or should do all these things we're talking about. We're just giving some suggestions and ideas. But I wanna just talk about supplements too. Are there supplements you think that are really helpful for the skin in, menopausal, women?
I mean, I'm a huge fan of vitamin D because we know that vitamin D also helps prevent acne, and I like, B6 has been shown to help with acne, so that's super good, and zinc has also helped. So, if you're fighting that, those are all helpful things even, in your 30s and 40s, but definitely perimenopausally. I think most people seem to be low in vitamin D. I think biotin is out. It's not been shown to be helpful with the hair, maybe helps nails, but we don't need to take extra biotin these days. What about you? What do you think can be helpful?
Love, vitamin D, and do you recommend people get it checked first, or you think just start taking a supplement? What are your thoughts?
I usually just start them. I find that either sometimes their insurance doesn't cover, or even if normal is 30, I want to see you more at 50.
Sure. Yeah, there's a wide range, and because I know in my multivitamin, it's pretty low, so I actually take a separate 5,000 international units of vitamin D, and I actually take it with K2.
Yeah, I like 4,000 to 5,000, of a gel cap or a gummy, but you can't take it in your multivitamin and get enough, and you'll get too much of something else that you don't want. So I think that's super important.
Do you like fish oil?
Oh, I don't. So good for you. I never have been able to find a way to take it and tolerate it. Hard on your stomach.
Okay.
Zinc can be hard on people's stomach too. I would say one thing to think about that I remember a lot of things happening to my friends is as they went into menopause, they often got very heavy periods. And that adenomyosis, the kind of irregular lining was sloughing and you could get anemic. So you have to pay attention. I remember personally my ferritin getting as low as 10, but I was anemic. And that's where you're going to get hair shedding, fatigue. So there are a lot of things that you have to keep up with your thyroid. Thyroid is a true concern, and I think not having your ferritin level too low. And most physicians will check those levels, especially people that are also concerned with perimenopausal symptoms. They'll be checking those things first.
Absolutely. I just eat a lot of salmon, so I'm hopefully getting enough omega-3 fatty acids with that. But yeah, those are kind of the big ones. I know some this isn't really I don't know if it has a role in skin, but people recommend magnesium, I feel like a lot for kind of midlife, and the citrate I think can help if you tend to be constipated. Maybe you're taking those iron supplements. I think the glycine can help with sleep if that's something you're struggling with.
Yeah, I do like magnesium glycinate for sleep, for headaches. If you tend toward migraines, I think. And that can also happen, I think, perimenopausally with the surges of the hormones. You might notice that you start getting migraines. So yeah, that's a good point. Magnesium's super important.
One of the most common symptoms that people know about are hot flashes with menopause and perimenopause, and those symptoms, sweating. I see it in my staff, walk around with fans because they're so hot, and it'll just come and they'll get all flushed. So, what can you do to help with that?
I guess definitely you can go on hormone replacement. But I know that I've treated people with Botox or Xeomin onto their scalp because they it so much. It was a big rage probably about maybe 8 years ago in LA when people were on their Peloton or in their class and they didn't want their blown out hair to get messed up so quickly.
I have thought about that myself.
It's pretty easy at last. I love it. I love using Botox or Xeomin for hyperhidrosis and some of my athletes that just are like sweating.
Now, what is that? The excess sweating?
For the excess sweating, yes. For hyperhidrosis, the excess sweating. But I definitely think during menopause, you just feel like you're always hot. You're wearing sleeveless in the middle of the winter. You can use glycopyrrolate, which you can use a topical and have that compounded. You can take the pills, but that could be a little distressing, maybe with feeling some side effects from blocking the cholinergic. So something topical or the injectable.
Any experience with Miradry?
I've never had it, but I know people that own the system like it. Yes, or used it in our practice. How about you?
I have sent some patients to have it done and they've seemed happy with it. Definitely have done the Botox. That can be helpful. But I think again, like getting to the root of why that's happening is hormones, right? And hormone replacement therapy versus treating all the symptoms. There also is a new patch that I've seen at some of the conferences. Are you familiar with there's like a patch for sweating?
No, we tried that for a while. I think that's been out for a while and I don't think it was affordable, so a lot of people wouldn't end up getting it, and insurance didn't cover it. So it seems like it kind of blipped in and out. It was a great concept. At one point, I remember there was a little device you could wear on your arm that would actually cool you and heat you, which I thought was kind of funny because when I was going through menopause, if I was at an event, I would literally go take a Coke can or something, put it right here. Because something about we do this with patients if they're getting vasovagal, like about to pass out, coolness here on their neck. But I thought that would have been a great invention if you could have had maybe in your Apple Watch to be able to cool.
Very cool. You just gave someone a great idea to run with. I've definitely seen those fans around the neck that people have, that they carry around with them. But yeah, it's real, and it's definitely can be just very interrupting for people's lives, to have to go through that. So there are some treatments, right? But really the main reason is from the fluctuating or decreasing estrogen. So hormone replacement therapy can be a big help for that. And we touched on estrogen cream a little bit in our last episode, but when and where do you use this? Do you recommend it for patients? What are your thoughts on that? And can anyone use it no matter how far out of menopause they are?
I think definitely. That I don't think we have to worry about. There's just isn't enough absorption systemically to worry about anything, and maybe it's like a motivation to do both. You talked about it. Can you use the same form of it, or are we gonna find I know there's some companies already making more elegant forms of it, but I think it's gonna help complement the products and the ingredients we already like.
Yeah, I agree. I've actually was curious to see how it felt and ordered some, and it does feel really really light. I mean, it feels like a moisturizer, and it's hydrating to the skin. So I think having a formulation just for face, neck, hands, that is going to be nice. It has a nice feel, and it can just be part of your skincare routine that you put on after your serums and before your sunscreen, right? So I think we'll be seeing more of that, especially for people who don't feel comfortable taking the systemic hormone therapy, that it is safe to use the topical. Have you seen any issues with melasma? That's one thing I do hear from people when they're on the estrogen, topical estrogen.
I don't think I've seen anybody use it long enough to know. On the lookout, especially if people are prone to it. But maybe there'll be other ways we can counter it using topical tranexamic acid, making sure they're using tinted sunscreen. But we all know there are people that really have a problem with melasma, so maybe they're not good candidates for it. I think it'd be great for the neck and for the tops of the hands. I mean, be able to use it as often on the face.
Well, Dr. Denman, this is always fun and love hearing your thoughts and pearls, as someone who has also, lived through a different time than we are now, where there is more acceptance of hormone replacement therapy. And you've kind of seen the impact of not having it in the skin and in your patients versus those few who did sneak and take it, right?
Yes, and it's funny, I just heard a quote from Kelly where she said, you don't say that your mother didn't go through menopause, that everyone goes through menopause. It's did she talk to you about the symptoms? Did she talk to you how she felt? Was it acceptable to talk about it? So we're so lucky that we feel more comfortable talking about it and asking for help from our friends, from our doctors. And even if your doctor is not on the train right now, maybe they're doing surgery, or they will refer you to someone who is really passionate about it.
Right. Yeah, there are lots of resources. Amazing. Dr. Denman, can you give us like your top 3 takeaways for someone who is perhaps going through menopause, seeing changes in their skin? Top 3 tips for them for navigating this season of life.
So I think the top tip I would take from today's talk is that don't be afraid if you do get acne, or if you get some quote unquote side effect from your HRT, hang in there. Maybe it's just a balance of the dose of the estrogen to progesterone. I think we're going to see that. Number 2, don't be afraid of the testosterone. Make sure it's the appropriate topical dose. And that's going to be something I think over time we're going to determine what that is. And number 3 is to keep going to a professional that's interested in observing you as an individual, and also coming up with a plan that involves topical things, orals, procedures to make it through menopause.
Yeah, it takes a village, doesn't it? So all great pearls. I love that. Where can people find you and follow you?
Well, I am on Instagram at Dermutopia Dermatologist, and also at dermutopia.com. And in Vienna, Virginia, you can come see me in person. Or I have an app that's available in multiple states if you need an online consultation.
Amazing. What is that, Dermutopia?
It's also Dermutopia through the Apple Store. Yes.
Amazing. Well, I will include all that in the show notes, and thank you so much for coming back.
Great. It's fun. Take care.
See you next week.